How does socioeconomic status impact healthcare accessibility? Have you ever wondered how your income or education level can affect your ability to access healthcare? Socioeconomic status, which includes factors like income, education, and occupation, plays a significant role in healthcare accessibility. People with lower socioeconomic status often face numerous barriers when trying to obtain healthcare compared to those with higher socioeconomic status. One of the most immediate barriers is financial. Lower income limits the ability to afford healthcare services, medications, and insurance coverage. This financial strain can lead to delayed care and fewer preventive screenings. For instance, individuals with lower income might skip medical visits due to the costs associated with care or transportation issues. In contrast, those with higher income typically do not face these same challenges. Additionally, people with lower socioeconomic status may experience longer wait times and fewer available appointments, even in systems that offer universal health coverage. Research indicates that individuals perceived as having higher socioeconomic status are more likely to receive timely primary care appointments. This suggests that socioeconomic factors can influence how healthcare providers treat patients and the access they receive. Older adults with lower socioeconomic status encounter even more challenges. They often have less access to preventive services, such as screenings and hearing aids, which can negatively impact their overall health and quality of life. Financial instability can lead this group to forego necessary care, worsening health disparities. Transportation is another critical factor that affects healthcare access for those with lower socioeconomic status. Limited or unreliable transportation options can hinder timely visits to healthcare providers. This issue is particularly significant for individuals with disabilities who may require accessible transportation. Discrimination based on socioeconomic status can also limit access to care. Healthcare providers and their staff may treat patients differently based on their perceived socioeconomic status, which can affect appointment availability and the quality of care received. Social determinants of health, including socioeconomic status, have a broad impact on health outcomes. Income and financial stress can affect access to affordable housing, nutritious food, and safe environments, all of which contribute to overall health and the ability to engage with healthcare services. In the context of disability, healthcare, and inclusive medical services, these barriers related to socioeconomic status are especially important. Individuals with disabilities often requiring more frequent and specialized care, and lower socioeconomic status can make accessing these services even more difficult. Inclusive healthcare systems must address obstacles such as cost, transportation, and discrimination to ensure equitable access for individuals with disabilities. To improve healthcare accessibility for those with lower socioeconomic status, several practical steps can be taken. Expanding affordable and inclusive transportation options tailored to individuals with disabilities is essential. Reducing out-of-pocket costs for medical care and medications can also make a significant difference. Training healthcare providers and staff to recognize and counteract socioeconomic bias is crucial. Enhancing outreach and support services can help connect lower socioeconomic status individuals, including those with disabilities, to available healthcare resources. Implementing policies that address broader social determinants, such as housing and income support, can further improve overall health access. In summary, socioeconomic status impacts healthcare accessibility through financial barriers, transportation challenges, discrimination, and systemic inequities. These effects are amplified for individuals with disabilities, making inclusive and equitable healthcare services vital to addressing these disparities.